All right, guys, in this video, I want to answer a question that I get pretty regular, which is what sort of side effects can you see from doing PEMF therapy? And the short answer is it's actually really, really safe, but there are some variables like anything that come into play, so I want to touch on those in this video. So for those of you who maybe aren't familiar, I have another video where I kind of go over what PEMF therapy is, what it does in the body, but in a nutshell, all your cells in your body have mitochondria, which are like the engines for a car. They're the engines for your cells. They convert your food into energy. PEMF has been shown, depending on the unit that you're using, to increase and improve your mitochondrial function. As far as you'll see increased mitochondria, what they call respiration, so they're operating more efficiently. You'll see in some cases increases in the number of mitochondria, so this results in a lot of benefits to you as the user. But it also depends on the unit you're using, not only how effective it is, but also can you see side effects. So I'm giving you some examples of potential side effects that I have seen. One personally is I was actually using a unit to address TMJ, temporal mandibular joint disorder. You get a really sore jaw, and so you can actually use PEMF on the head and neck area, but it is a side effect that you can see because I was too aggressive with it in the head and neck area, and it can result in a headache. It's not a serious deal, but again, that's a potential side effect that I've seen. Another one that I have seen is because it's helping your mitochondria, you can really see an improvement. Your cells are taking in more nutrients and they're also expelling more toxins. So you can see almost kind of a people flushing out these toxins. But another thing you can see is if people are on, say, we saw this in a person on pain medication, is that they noticed it was more effective. They became a little loopier. They were taking hydrocodone. So you do have to be somewhat careful on people who are on powerful medications. I say bodily function isn't, that's a bad thing, but you can see people who maybe have bladder issues or constipation. They're not going to the bathroom that often. They can go in and use PEMF, and that can resolve that issue pretty quickly. In fact, they may have to interrupt the session to go use the bathroom, which it's a good thing. I call it a side effect because it's something you need to be aware of. And another one I would mention is hydration. I always encourage people that when you're done with the session, you want to drink plenty of water. Again, it kind of goes back to the medication thing, is that your mitochondria are operating at a higher level. You have increased blood flow, so dehydration can be a bit of an issue. So we always encourage people to drink more water, drink more electrolytes. So, but outside of that, and I tell people this all the time as a pharmacist with a completely straight face, is I don't have a medication on the shelf that's as promising and as safe as PEMF therapy. It's just very, very, very low side effect profile when you use it correctly. Like I said, with the headache thing, you can get too aggressive at times. But outside of that, now the one thing I will point out, groups of people that do not want to use PEMF is any sort of electrical device that might be implanted in your body. For example, pacemaker, can't use that. PEMF in people with pacemaker. You cannot use it, for example, deep brain stimulator, vagal nerve systems. Those sorts of electronic devices are a no-go when you're using PEMF therapy. So do keep that in mind. So I'd like to know in the comments, have you used PEMF? Was it beneficial for you? Did you experience any side effects? Let me know. It is helpful for me, and it's helpful for the other folks that watch the video. So I hope this was helpful, and I'll see you in the next one. Thank you.